Are there supplements to help with prednisone withdrawal? This is a really important question because prednisone withdrawal is real and painful and miserable. And so let's talk about prednisone withdrawal and then what we can do to help with the symptoms. So, prednisone withdrawal happens when your body is feeling a gap between the dose of prednisone or methylprednisolone or other steroids that you are taking and the current amount you're getting. It can happen after just dropping and slowly tapering off, or it can happen upon cold turkey taking nothing. So from going from 20 to 15 or from 20 to 0. It can happen either time. And it really depends on your personal situation, your body, your genetics, the dose you are taking, and many other factors. If you want to know more about that, watch one of my other videos about prednisone withdrawal. But what's important is that there are symptoms of prednisone withdrawal that aren't just uncomfortable, but can lead to fatal complications. So that would be called adrenal crisis. If you were to go off prednisone cold turkey, go from 20 to 0 after having been on it for a while, that can lead to adrenal crisis, which means your blood pressure, your blood sugar, and things like that stop working, that you cannot respond to going from sitting to standing and things like that, that you end up in the hospital and they give you blood pressure medications and all of these things to try to support you. And it's possible that can be a fatal complication. So we don't want that. And we don't want the symptoms of prednisone withdrawal, which include achiness, like joint and muscle pain, fatigue, not wanting to get off the couch, possible fever, possible nausea. Essentially, it feels like you kind of have the flu. So I'm going to read the specific question that triggered this video. This person said, I've been on 24 milligrams of Medrol for 2 months. Now, Medrol is methylprednisolone, and it's not exactly the same as prednisone. They're a little different, but very similar. However, the side effects are getting out of hand, so I need to start reducing. I've reduced 3 milligrams in 2 weeks, but the withdrawal symptoms are brutal. The disorientation, anxiety, and most of all, swollen and really painful joints are trying to kill me. Not like just the side effects from Medrol were already bad enough. Anyway, are there any supplements that help with the withdrawal or might make it a bit more bearable? Or something in particular for swollen and painful joints? My knees look and feel like watermelons. Any advice on tapering off and a good reducing schedule are also welcome. My doctor told me to figure it out myself. Okay, so there are several things, and I'll get to the supplements last, that might affect things. So first of all, the steroids themselves have different side effects and different withdrawal tendencies. So in this case, the most painful thing seems to be the swollen joints. And it's possible that switching steroids could help. So some, like dexamethasone, often cause lots of swelling. And switching from dexamethasone or methylprednisolone to prednisone or hydrocortisone may minimize that effect itself. So you could ask your doctor, hey, you've been prescribing methylprednisolone. Can I switch to prednisone or can I switch to hydrocortisone? And there are conversion calculators to figure out exactly what dose to take. But that would be one first step that may change the way you're feeling on its own as a simple first prescription only method that you can only do with your doctor's help. The second thing you can do with your doctor's help would include getting on a water pill, something that can help minimize all that swelling, because essentially what's happening is prednisone is affecting the water balance of your body. It's making it hard for your kidneys to deal with the sodium and potassium balance and leading to swelling at joints like your knees. I personally dealt with it and it was super annoying. You can see all the side effects I dealt with, including the swelling of the knees in this image. And so you're not alone in feeling this way. It definitely happens. And potentially getting a water pill can help. So this would be things like furosemide, which is Lasix, or hydrochlorothiazide. Those potentially may minimize the amount of fluid that is being retained on your knees. And hopefully you'll feel a little more stable as you are tapering off. So now let's get to supplements during withdrawal. Now, this is tricky because you're dealing with the side effects of the steroid itself, as you mentioned, and you're also dealing with the prednisone withdrawal symptoms. And they're both miserable and can actually be opposites. So I mentioned some symptoms of prednisone withdrawal can be low blood sugar and low blood pressure, but some side effects of prednisone include high blood pressure and high blood sugar. And so it's hard to find the precise balance for you, but either way, there's a dysregulation of lots of nutrients and minerals in your body that is leading to these complications. And so, what we need to focus on are things like potassium. Now, potassium is a metal mineral that your body uses with sodium to keep your water balance. And when you have too low of potassium, you start holding fluids, water weight gain essentially, because you're holding on to sodium and you're losing potassium. We want to get those into better balance. So if you supplement potassium and at the same time minimize your intake of salt, sodium chloride, that can help get it into a better balance. So laying off of chips and basically most processed foods in the standard American diet can really help. So that balance is a good place to start for those symptoms. Now there's the blood sugar issues. And for that, I recommend chromium. Your body normally has chromium, this metal mineral, in a very small amount, but prednisone is making you pee it out, so you're missing it. The lack of chromium causes blood sugar issues with the insulin. And so you need to give back chromium picolinate to stay in the right balance for your blood sugar. And the best kind of chromium is called chromium picolinate. It has tons of studies showing that it helps not only with blood sugar, but also with weight and specifically losing fat weight instead of muscle weight, because that's one of the issues we're having right now is muscle pain, right? We don't want to have any more loss of muscle mass. And so chromium picolinate can help with that. Next, vitamin D is really important to keep everything in balance that prednisone is messing with, because prednisone is, again, stealing vitamin D and calcium and other minerals that are important for bone metabolism, for keeping strong bones. As you mentioned, you're having bone pain, and prednisone is stealing calcium from your bones, so you need to be giving that back as well. Magnesium is really important to keep the calcium in balance. They need to be in a really tight ratio in order for the calcium to do its job and not deposit on your arteries. And you also need vitamin K2 to keep the calcium from depositing on the arteries and going to the bones. So all of those together help keep strong bones to hopefully prevent these bone issues that you're having, not just bone pain, but bone loss that can lead to osteoporosis, that can lead to bone breaks and loss of height. And so if you're like, wow, that's a lot of things, I wish there was something out there that was designed specifically for people on prednisone, that's exactly what I said. And so I created it. I created Nutranize Zone. It's designed specifically to help you while taking prednisone, while tapering off prednisone, and while recovering from taking prednisone and suffering withdrawals. It is exactly what you need. It has all those nutrients that you need at the right dose to help support you while on prednisone. And you can get it at nutranize.com. You just take 2 in the morning with your daily dose of prednisone and 2 at bedtime. And the combination helps you feel like yourself again while you're recovering from taking prednisone. The one difference between a person taking prednisone and somebody suffering withdrawal that I would add on to this, because this is an all-in-one, this is all you need. But if you're really suffering withdrawals, the one I would add back on that is in a lower dose, because it really needs to be sensitive, especially for people with kidney issues, is potassium. And it's pretty hard to actually get enough potassium from supplementation. And so you may need a prescription for potassium as well. So when your doctor prescribes the water pill, they may also prescribe a potassium pill and switch you to a different steroid. Those are all possibilities of how your doctor can help you. Granted, The very most important thing for you with prednisone withdrawal is getting to the lowest effective dose where you didn't have symptoms and tapering even slower from there. And that was the final question you asked. Any advice on tapering off and a good reducing schedule are also welcome. My doctor told me to figure out this out myself. So I created a downloadable, free PDF printable taper schedule that you can use. It has several options you can choose from because you got to figure this out yourself. And it includes a really aggressive fast taper if you're like, I just got to get off of it, or a more prolonged and gentler taper. And you can do that slower over time. You just see what dose you're currently at and then start from there. Check it out. Download my free printable PDF Prednisone Taper Chart. Just click the link below and you can download it now. Signing off as Dr. Megan, your prednisone pharmacist.